Let me introduce myself. I'm Ramuti, lecturer, Department of Microbiology, Meenakshi Ammal Dental College and Hospital. Now I'm going to take lecture on Candidiasis. It is the most common fungal infection in humans affecting the skin, mucosa, and various internal organs caused by the organism Candida. It is a yeast-like fungus that produces pseudohyphae. Various species of Candida. Among Candida species, Candida albicans is the most common pathogens causing human infections, and also other Candida species like Candida tropicalis, Glabrata, cruzi, etc. can also cause human infections. Next one is the pathogenesis. It is a worldwide in distribution, which accounts for the most common fungal infections in humans, both in HIV and non-HIV infected people. Next one is the predisposing factors, and these are all the factors which predispose to uh, candidal infections. Physiological state, two extremes of age, infancy and old age people. In case of infants, there is an immature immune system, and old age people there is a decreased or waning of the immune system, and also the pregnant women are predisposed to this candidal infections, and those who are having low immunity, such as the person who's taking steroid or immunosuppressive drugs, post-transplantation, malignancy, and HIV infected people, and also patient on broad spectrum antibiotics. Uh, and then the other comorbid conditions such as diabetes mellitus, then febrile neutropenia, zinc and or iron deficiency individuals. The next one is the virulence factors. These are all the virulence factors. Adhesions, which helps in adhesion to the skin and then the mucosa. And enzymes such as aspartyl proteinases and serine proteinases, which mediates the tissue invasion process. And toxins such as the glycoprotein extract of Candida cell walls are pyrogenic in nature. And pseudo, if it is the organism produce pseudohyphae, the presence of pseudohyphae which indicates that the patient is on active infection. Next one is the clinical manifestations. Invasive candidiasis, mucosal candidiasis, cutaneous candidiasis, and allergic candidiasis. We'll discuss one by one. First one is the mucosal candidiasis. In that oropharyngeal candidiasis, in this conditions, the patient will get white, adherent, painless patches. And in case of vulvovaginitis conditions, the patient may get pruritus, pain, and then the vaginal discharge. The discharge which will be white curd-like discharge in chronic cases. In case of men, will get balanitis conditions. There is an inflammation of the foreskins or the head of the penis, and then esophageal candidiasis. Also, the few individuals might get this condition, and also some of the individuals they may get angular stomatitis or and denture stomatitis also. Then other conditions such as chronic mucocutaneous candidiasis. This chronic mucocutaneous candidiasis most commonly seen in infants and children with deficient cell-mediated immunity, particularly the T cell defect. Next one is the cutaneous candidiasis. There are various conditions the patient might get. The first condition is intertrigo. In these conditions, the patient will get erythema and pustules in the skin folds, which associated with tight-fitting undergarments and sweating. And also, the individuals might get the conditions like onychomycosis. It is an fungal infections over the nail bud. And then the diaper candidiasis, it is in the individuals or the infant might get pruritic rashes associated with the diaper, those who are using the diaper. And then the perianal candidiasis, also the few individuals might get. Next one is the allergic candidiasis. So in these conditions, there is an allergic reactions to the metabolites of candida, which is characterized by vesicular lesions in the web spaces of hands, and other areas. Next one is the invasive candidiasis, such as urinary tract infections. It is one of the important in conditions caused by the Candida albicans. And apart from that, pulmonary candidiasis. Few individuals they may get pulmonary candidiasis, and then the septicemia conditions, other conditions such as arthritis and osteomyelitis conditions too. The next one is the ocular infections. So few individuals they may develop ocular infections such as keratoconjunctivitis and endophthalmitis also. And the Candida organisms can also cause nosocomial candidiasis. Next one is the laboratory diagnosis. First one is the direct microscopy. If you do the gram staining, you can identify the gram-positive oval budding yeast cells with pseudohyphae. This is the pseudohyphae. It is a gram-positive budding yeast cell. The next identification is we can inoculate the patient sample on the culture media such as Savarro dextrose agar. So after incubations, you can identify the growth of an Candida species. The Candida can produce creamy white and pasty colonies on Savarro dextrose agar. And these are all the tests for species identification of the Candida. The first one is the germ tube test. This test is positive for Candida albicans. So in this diagnostic tool, we have to inoculate the Candida cultures into human or horse serum. So after inoculations, you have to incubate the particular tube for about 2 hours. So after that, we have to make prepare the wet mount examination. So in that, we can identify the germ tube positive. That means the Candida albicans can produce germ tube positive test. So it is in a long tubular-like projections which can extending from the yeast cell. The next test is Dalmoplate technique. In this technique, you can identify the chlamydospore protection of the Candida species. And also we can inoculate the Candida organisms on chrome agar. So based on the colonies, we can identify the various species of Candida. Next one is Candida albicans positive for growth at 45 degrees Celsius. So other species which may not grow at 45 degrees Celsius. And also several other carbohydrate assimilation tests and carbohydrate fermentation tests also there to identify the various species of Candida. And also the molecular techniques such as the polymerase chain reaction, which is used to identify the various species of Candida. And the first picture, you can see the light green color colonies produced by the Candida albicans. And in this second picture, you can identify the germ tube positive. There is a long tubular-like projections which can extending from the yeast cell. And then third picture, you can see the chlamydospore formations if you inoculate into a Dalmoplate culture. And next one is the immunodiagnosis, antibody detections against the cell wall menin antigens can be detected, and also by antigen detections such as the antigens can be used like cell wall menin antigens and cytoplasmic antigens can be used, and enzymes such as enolase enzyme can be detected by using the immunodiagnostic tools. And also you can detect the various metabolites of Candida species like mannitol and arabinotol can be detected. And also beta-D-glucan assay, it is one of the markers of invasive fungal infections can be detected. And then next one is the treatment. For cutaneous candidiasis or oral tests, topical azoles is a drug of choice. Where in case of esophageal and vulvovaginal candidiasis, oral fluconazole and caspofungin is a drug of choice. For disseminated candidiasis, liposomal amphotericin B or caspofungin or voriconazole can be used. The next one is the Candida auris. It is an emerging species of Candida, increasingly reported in the recent past. The manifestations, it can causes candidemia conditions, abscess formations, and then the ear infections. How to diagnose this Candida auris? It is very difficult to identify with the standard laboratory methods. Can be used certain other molecular techniques such as multitoph and PCR methods, polymerase chain reactions, are the important techniques to identify this Candida auris. Next one is the treatment. It is a multi-drug resistance organisms, so can be used capsofungins or lipid-based amphotericin B can be used to treat this Candida auris infections. Thank you.